Regular and timely eye examinations are important because they allow your physician to diagnose and treat glaucoma years before you'd ever develop any symptoms from this disease. In this video, we show the story of a patient who was diagnosed with glaucoma too late and whose eye pressures were not adequately controlled. In the top photo, you'll see the world as a glaucoma patient does. In the bottom left figure, we show how the optic nerve appears to the physician. In the bottom right figure, we show computerized visual field testing results. This photo shows the subjective vision, optic nerve, and visual fields of a patient with early glaucoma. Notice how vision for the patient appears normal and undisturbed. The optic nerve has a pink, healthy rim of tissue all around, with a small central white area called the cup. The visual field of this eye is full. While undergoing the visual field measurement, the central crosshairs are where the patient is fixating during the test, and in this case, central vision corresponds to the woman in the center of the photo. The dark spot towards the right of the visual field test is the normal blind spot that everyone has. However, in this patient, the eye pressure was high and not controlled. Over the years, the optic nerve's upper rim changes and becomes thinner. At the same time, notice that the central white cup of the optic nerve becomes larger than before. However, the visual field testing has not yet been affected, and the patient's subjective vision still appears normal. Years later, while the optic nerve appears similar, the visual field testing demonstrates damage to the lower portion of the visual field. The patient, however, does not realize that this portion of his vision is lost and still has normal subjective vision. Eye pressures have not yet been controlled, and glaucoma damage progresses. As years pass, and with eye pressures uncontrolled, visual field testing demonstrates that the lower portion of the visual field has progressively worsened, all the while the patient, only noticing his central vision, is not aware. However, the patient's side vision is starting to change. As time goes on, the optic nerve continues to deteriorate, with a larger central whitish cup area indicating loss of nerve rim tissue. Visual field defects that had mostly affected the lower vision have now expanded to involve the upper vision as well. Nevertheless, because changes happen so slowly, few patients are still aware that their side vision is worsening. Eye pressures have remained too high for the health of this optic nerve. In the advanced stages of glaucoma, patients can sometimes begin to tell that their vision has indeed worsened. Often patients complain of blurred vision or missing parts of their vision. Many patients think that these are due to needing new glasses or changes from cataracts, both of which can be readily fixed to improve vision. However, with glaucoma, once vision is lost, it cannot be restored. If the patient were examined sooner, our optic nerve exams and visual field testing would have diagnosed glaucoma years earlier. In the severe stages of glaucoma, patients are aware of their limited peripheral vision. Unfortunately, too many patients first come to university eye specialists at this stage of their disease, hoping to finally get their eye pressures controlled. However, even if the glaucoma specialist controlled the pressure with eye drops, lasers, and surgery, lost vision cannot be recovered. Controlling eye pressures can only help slow down the rate of vision loss, but cannot stop it completely. The best way to prevent such vision loss is to identify glaucoma as soon as possible and to control eye pressures upon diagnosis. That's why making an appointment with the university eye specialist for a complete eye exam, including tests for glaucoma, is critical to your vision.